Dr. Rochelle Walensky, who has guided President Biden's COVID response as director of the Centers for Disease Control and Prevention, is stepping down from her post next week.
Dr. Walensky, took the helm as director during the pandemic amid dwindling public trust in the agency, and she is here with us now to discuss, and we are so lucky to have you with us.
Thank you. Delighted to be with you.
All right, so you took over in 2021. It was a year into the pandemic. Can you talk about the challenges that you faced, especially when it came to boosting morale?
Yeah, it was a tough time. So in the country, we were losing 4,000 people a day, deaths due to COVID-19. Morale at the agency was hard. We were all working remotely, so even just getting to know people. And yet there was so much hope because this was just weeks after we had data from the clinical trials demonstrating the efficacy of the vaccine. We had a lot of work to do, both to reinstate morale in the agency and trust in the agency overall, but then also to get, now we have 670 million vaccine doses into arms. So a lot of work has happened.
You've acknowledged that the CDC didn't meet expectations during the pandemic, and communication was a major struggle, really affected public trust. Do you think the agency is in a better place today?
Yeah, so much of the work that we have done over the last year and a half in our efforts called CDC Moving Forward was to listen to key stakeholders, people around the country, people who utilize and are consumers of public health, to really understand what were some of the challenges that we had. Communications was one of them, and you know, in truth, this has been something we've been working on a lot in our CDC Moving Forward efforts. We've launched a strategy for training and how we do communications. We've sped up the speed at which we get our science out there. We've put technical reports out. But importantly, and I think it's important to understand that, you know, we are not communicating only CDC. There have been a lot of nefarious actors that are working against us in health and public health and science to try and muddle the message. And a lot of what we're doing now is to sort of fill that void when there is a void in messaging, so it's not filled by nefarious actors.
You're what we call in the business a real doctor. When you took over the CDC, you were leading a division of infectious diseases at one of the country's and the world's largest medical centers in Boston. When you transitioned to leading the country's largest public health agency, how difficult is that balance for you as a physician and as a messenger to strike between public health recommendations for hundreds of millions of people and what you would recommend treating one patient? You literally left the bedside to take this position.
Yeah, that's a really interesting question. And I'd done a lot of work in health and public health. My research was in health and population health. So I had experience in that. But as you say, you have to remove your stethoscope and talk to the country and talk to the world in terms of policy. And that has been, you know, it has its moments. It's hard in some ways because you want to ask, get deep into the, like, well, I want to be specific to you. But in fact, at a policy level, you can't be. And when we make recommendations, we have to make them for the general. We have to make them for the public. And then the public, I think, on the consuming side, on the receiving side, has to recognize that, you know, how do these recommendations apply to me in my rural town, in my home where I have an immunocompromised family member, in, you know, my situation where we are, you know, frontline workers. How do I take that information and apply it to me?
And Doc, a lot of medical experts have raised some concern when it comes to medical misinformation, your concerns about that, and it's showing up on the campaign trail as well.
Yeah, I do think that, look, we want people to make decisions about their health based on their health and their values and their risk assessment, not based on how they voted. That health should not be about based on how you voted. You have values, and we want people to understand the information that's important to them, to make the smartest, the factual information, to make the smartest decisions for them based on their personal situation, their personal health assessment.
This is the first time that a lot of the country saw science as it was happening, seeing the sausage made and the things that we were learning through the pandemic. The information was changing. What are you hoping people take away in preparation for a possible next pandemic?
Well, first, I think we've made a huge amount of strides in health and public health. We've really uncovered where some of the where things are fragile and where we need ongoing investments in health and public health. We're doing a lot of that work in CDC. We also need Congress's help as we think about resources and authorities and budgetary flexibility so that we can be the best CDC public health that we need and want to be. It's also the case that people really need to understand the challenges, their own specific risk assessment. And I think that that's really key and important.
Thank you for your service, Dr. Rochelle Walensky, Acting Director of the CDC, until the end of this week, right?
Yes, indeed.
Thank you.
Thank you so much.
All right, thank you and good luck.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.